Good evening, everyone. I'm Councilmember NITHYA Raman, representing the 4th District here in Los Angeles, and I'm so glad to be here with you all for our CD4 conversation. Tonight's conversation addresses a devastatingly common issue among Angelenos, and one that is all too often unseen: interpersonal violence, also known as domestic violence. For our conversation tonight, we'll be using these terms as well as their abbreviations, IV or IPV and DV. Before we move forward, if you are in immediate need of assistance, please call LA County's Domestic Violence 24-hour support line at 1-800-978-3600. According to the U.S. Department of Justice, 4,000 victims of interpersonal violence are killed in the U.S. every year. And this is just an astounding statistic, but nearly 1/3 of the women who seek care from hospital emergency rooms are there for injuries resulting from domestic violence, a truly staggering statistics. Behind these numbers, however, are real people who often don't know where to turn. Tonight, we'll be talking about this public safety crisis and what we can do as both a community and a council office to end it. We will discuss the rise in interpersonal violence during the pandemic. We'll talk about communities vulnerable to this kind of violence, and we'll talk about the resources and practices for education, prevention, and intervention. I am really thrilled today to have such an incredible panel joining me tonight. Here with us, we have Terra Russel-Slavin, Director of Policy and Community Building at the LGBT Center; Abigail Marquez, General Manager of LA's Community Investment for Families Department, which was started to support residents with economic security and safety and oversees the city's domestic violence system; Elsa Martinez, LMFT, Clinical Program Manager for Domestic Violence Services at Strength United at the Cal State University Northridge Center, that really provides a unique interdisciplinary approach to ending abuse and violence through the collaboration of mental health professionals, educators, researchers, students, and volunteers. And finally, we have Commander Natalie Cortez, an officer with LAPD's Valley Bureau, working to ensure immigrant and monolingual communities also get access to DV education and services, which is so important. Firstly, I want to ask you guys a question because I want to make sure that we're starting with a definition of what interpersonal violence really is. Can you share what types of behaviors, what types of interactions really qualify as interpersonal violence? And any of you are welcome to answer and jump in.
Hi. So, I think when we think about domestic violence, we think about physical abuse, right? That's the first thing we think about. But in reality, it can be anything from economic abuse, emotional abuse, psychological abuse, and sexual abuse. It's any type of behavior that one person is trying to use to gain power and control over the other person, and to maintain that power and control.
Wow. That's a very useful definition. I'm curious about how the city approaches the definition of this violence or this kind of abuse. And I wonder whether Abigail or Commander Cortez, you could speak to how the city defines it and how it responds.
Sure.
Using that definition.
I think certainly the way that it was just recently described by our colleague Elsa Martinez, but I would say that we're starting to evolve as well as a city to be a lot more inclusive of the other types of abuse. There was a mention of economic abuse. We have been looking at that very intentionally as a city. The Community Investment for Families Department oversees both the domestic violence shelters, and we have a human trafficking shelter, and that includes labor and sex trafficking. So I would say that we have evolved, and we're starting to really look at all forms of abuse: physical, psychological, and emotional and economic abuse.
And it's that type of awareness you're talking about, and understanding the more full spectrum of it for us. When we go, it's during the radio call. And we actually look at it from the legal perspective. Do we have a felony? Is there a type of, significant injury? Who's the primary aggressor? And then, or do we have, a misdemeanor battery? And what enforcement action do we take? But our whole goal is, when we are there, to determine that primary aggressor, to remove the situation from the house. And again, it's not necessarily, like you said, always stereotypical, male, female. It runs the gamut now, and our officers are educated, they understand, and we, the importance of that and take that action.
Yeah, I just want to go back to something you said, which is I think there's a tendency to really focus on physical violence and bruises or injuries, and that's often when the point of law enforcement comes through. But having talked with hundreds of survivors over the years, you know, often it is the emotional damage, and that takes a lot longer to heal from. And if we can start shifting away from just waiting to need physical violence to intervene, then I think we can really have the conversations about prevention and early intervention that can hopefully help, I think, change systemically just the significant prevalence.
Yeah. Interesting. Okay, well, so I want to go back to that idea of prevention and how the expansion of the definition can get us to talking about prevention. But I also want to talk a little bit about the fact that this violence can take so many different forms. Abuse can take a lot of forms. And I think different communities can be victims of that violence and can be survivors of that violence. And I wondered whether you could share a little bit more about kind of who is particularly vulnerable to being impacted by interpersonal violence.
Well, I can speak from what we see, and unfortunately when we see it, it's often physical. And what we find with our victims is this has been occurring. This isn't the first call. But what I do find with domestic violence and throughout the years is there is no socioeconomic status to it. It's all levels. It's all genders, all types, and unfortunately, it's a lot more prevalent than I even think we know. Because, like as I indicated, we always seem to be called when it's much more physical, and that's when people have said, "I've had enough."
Yeah, I mean, when we look at intimate partner violence in LGBT communities, we generally say it's happening at similar to slightly greater rates. But increasingly, now that we're finally starting to get some studies that look at broad-based national demographics and are asking questions about sexual orientation, and hopefully we'll soon be asking questions about gender identity, the reality is the numbers are astonishingly high, and particularly for certain subset populations, so including bisexual women, LGBTQ, Black, Indigenous people of color, youth across the board, and transgender people. And so just to put it into numbers, about 60% of bisexual women will experience intimate partner violence, 50% of trans people. LGBTQ youth are 3 times likely to experience dating violence.
And how does that compare to the prevalence? I mean, for the last statistic you provided, a comparison statistic. I wonder if you might speak to that comparison statistic for the 2 populations that you discussed earlier.
Yeah, so we say across the board usually 1 in 4 to 1 in 3 lifetime prevalence rates. But if you're looking at youth just within like the last year, in one study, a national study, you had almost 30% of LGBTQ youth in a year's time period experience teen dating violence.
Not a good way to start a relationship so young, to be exposed. Wow.
Yeah, that's another population that I was curious about is undocumented residents, and the prevalence of interpersonal violence or intimate partner violence in those communities. And I wondered whether any of you could speak to that.
I can certainly speak to that. I think I bring a different perspective to the conversation. I'm not a practitioner in the field. I've been focused mostly on addressing some of the policy barriers that have existed in city government. When we first started looking at how the city was funding the domestic violence shelter system, we first realized that we were severely underfunding the system. So we were funding the system at $13 per night per bed, just a couple of years ago, as little as 5 years ago. Wow. And if you do a comparison in how we're funding our homeless shelter system, which is still not adequately funded, it's funded roughly at $50 to $60 per night per bed. The domestic violence shelter system was predominantly being serving women. And so I've been really trying to focus on raising awareness and having policy that is looking at the intersection between domestic violence and homelessness. There's been numerous studies as recent as the Downtown Women's Center released a study. If you did not experience domestic violence before becoming homeless, you certainly, unfortunately, will experience that once you are homeless. So really providing more upstream services, really focusing on the intervention. We do serve a large number of immigrant women in our shelter system. We're fortunate that our funding is not restricted to be able to provide those services, but we need to continue to provide provide a continuum of services post-shelter. And that's what we've been focusing on in the last couple of months.
Yeah.
Fantastic.
And I know from my experience working with people who are experiencing homelessness that talking to individuals, learning about their histories, their personal life histories, domestic violence plays such a huge role in their path to the streets.
Right.
And an intervention earlier on could actually serve as a homelessness prevention measure, really,
Right.
As much as an intervention in someone's life and improving their own material conditions. I don't know, Elsa, if you wanted to.
Yes, and we do see that, undocumented folks are less likely to call the police, for fear of deportation, or, their abuser could be telling them, if you call, if you get law enforcement involved, this is what's going to happen. Your kids are going to get taken away. You're going to get deported. You're never going to see your family again, right? So there is that barrier when. With that population, another thing is, especially with Strength United, we don't ask people, for a documentation status or anything like that, but when we speak to people, they say, well, we didn't think that this was available to us. People are under the impression that they don't have the same rights or, the same services as others.
Yeah, and how do you go about dispelling those myths? I mean, are you able to do that work? Are you funded to do that kind of outreach work, or is that something that the community needs more funding to do?
We could always definitely use the funding, right?
Yeah, gotcha.
But we do have a great prevention team that goes out and will speak to the community about domestic violence. But unfortunately, it's still that taboo subject where we'll put on these events. We put on talks with LAPD, and a lot of people won't show up to them.
Yeah, I've done them both, bilingual and English and Spanish, and that narrative is true. It's very prevalent, and we try to say we don't want to know your immigration status. We will not ask. We want to help you, and we work in partnership with Strength United, and we have a family justice center. We offer wraparound services. One thing that we're also doing too, I can tell you from Operations Valley Bureau, is we built a pamphlet that we put in the actual offender's booking property. So we're hoping that while they're getting their stuff and they're leaving jail, that they'll see this pamphlet and maybe make a change and reach out to some of the services. So we're trying every angle. I shared with you and the council, and I can't thank you enough for doing this. We are up just in your area this year 22% in domestic violence. That's a lot of victims.
Yeah.
I can't say it's pandemic related. I'm sure anecdotally I can.
Yeah.
But I just thank you for the awareness today.
Yeah, and I think actually it was our conversation with you that brought the rise in domestic violence to our attention, particularly in our district. And I wonder whether you might speak a little bit more to those stats, because I think for us, one of the biggest surprises in our conversation with you, one of the reasons we wanted to have this conversation is, as a council person, you're tasked with public safety, and obviously your department is one of the primary ways that we respond to that in the city so far, along with a whole set of other departments. But to me, I didn't realize until you told us that so many of our assaults are actually related to domestic violence.
Yes.
And I wondered whether you might be able to shed some light on those statistics, because I think for us, it's like intervening in domestic violence is a public safety measure that is so essential to our district's safety, you know?
No, absolutely. And like I said, when I looked at the numbers, I looked citywide, I think we're up, this was about 12 or 15%. Just in Operations Valley Bureau, which is Mulholland all the way north to county line. It's a large 233 square foot area. We're up 20%, but in your district is where we saw the greatest increase. It's actually 22.5% of domestic violence. Is it people being at home, so they're more likely to call? There's no escape because we've been locked in. But it's startling. It's something that we're continually looking at, and we're trying to find ways when we do those workshops, we do that outreach, but if they're at home, how do we get to the coffee table?
Yeah.
And other than coming in and doing the enforcement component, to have the conversations to stop the violence. And that's why this is so important.
Yeah. And you had a stat also that you shared with us about DV as a percentage of total assaults in the district, right?
Yeah, in your district was, so we looked at the violent crime, we looked at aggravated assaults. It falls under that, and that was the 22.5% of all aggravated assaults is domestic violence. I didn't even include to that the family violence, which often runs hand in hand, but I really want to stick to that issue because those were, when we talk, startling numbers.
Yeah, that's enormous.
Yeah, I mean, I would just add that the early months of the pandemic, especially as the stay-at-home order was implemented, it was a very stressful time for our providers, and I'm sure you all can attest to that. We were just, we're already at capacity in our city's DV shelter system. We only have funding and space for roughly 3,000 survivors, and most of our shelters are at full capacity.
Really?
Yes, and so that is the challenge that we have as a city, as a county, as a region, as a country. And so during the early months of the pandemic, we were hearing these just horrible stories of women, primarily who were actively fleeing. They were being quarantined with their abusers. And so if you can just imagine, and just the trauma that our own caseworkers had to endure. And so we were able to respond first initially through the mayor and the mayor's fund. He raised private dollars, and we launched what we refer to as Project Safe Haven, which is was the largest actually in the world. We're very proud of the work that we did. Initially funded with $5 million in private dollars, and then through your work, Councilmember, the council allocated an additional $5 million through the coronavirus relief funding. We were able to expand that program for a period of 10 months, and we housed close to 3,000 survivors who were actively fleeing, who had nowhere to go. These are low-income individuals who had no other recourse other than to seek our help. And so we were able to respond. And we're very proud of the work that we did in partnership with all of our partner agencies, and that we were able to transition 97% of the survivors that were housed into alternative housing. So it's very similar to the work that we did as a city with Project Roomkey, but we ran our own parallel program for survivors. And so we should all be really proud of it. I wish we were celebrating something different. I wish we didn't have this crisis that we have to respond to, and it was very much illuminated with the pandemic.
What do you think the real demand for beds is in the city?
It's hard to tell. I mean, I don't have, maybe our experts here can tell you. I mean, we get roughly, 40,000 calls that are, that are DV related annually. We're turning away a high percentage of those individuals that are calling, seeking support. It could range from legal services that they may need. They may need shelter services. Maybe they need temporary. I think what we want to do, and we're starting to do more of this, is provide flexible funding for our providers so that they offer alternative types of supports, because shelter isn't the only option, and it should not be the only option. And we're starting to see that trend, not just in the city, but in the county, I think at the federal level, and certainly with our homeless service agency as well.
Wow. And when we respond, it's that moment of crisis. They've been beaten. We have kids crying. A whole family getting ready to be displaced. It's not an easy decision. And you're right, maybe with those alternatives, because sometimes they don't want to go to a shelter. They want money for gas to go, just to a family's member's house. And so, those are some fantastic ideas that we can
Or they don't
exploring.
have money to move out.
Yes.
It's the economic abuse. So if we actually help them with a first security deposit or a first month's rent, or even support their rent for 6 months while they stabilize, that is, tremendous support that we can offer.
Yeah, and I would say we've been working with some funding from the state on some grants that have allowed us to assist people with housing. Shelter in particular has always, for a long time, been a challenge for LGBTQ communities. And when you think about the fact that, about nearly half of the survivors we work with are men, and that, they are often not, most shelters, domestic violence shelters, are explicitly focused on women. And then, and also even with trans people, if they, identify as women, they may not feel comfortable or experience bias. And so that's been a real challenge. And oftentimes the only, for a long time, sometimes the only remedy was to go into homeless shelters that just don't have the confidentiality protections and other safety issues when you put an already marginalized population within a potentially dangerous situation.
So is the LGBT Center taking action specifically to address the needs of DV survivors in the LGBT community?
Yeah, I mean, we've been providing programming for decades, and we every year assist hundreds of survivors and work around housing, work around safety planning, and also try to engage in policy advocacy and training with our domestic violence programs. We know everyone's trying to do really good work, but I think as there's been a lot of evolution, it's how do we center the margins? How do we make sure that the most vulnerable are getting access? And sometimes that requires that we look at things a little differently.
Yeah, absolutely. I want to talk a little bit about the stats that we just heard, because I do think that we hear these numbers and they're alarmingly high, but I've also heard that there's significant underreporting around DV. And I was just wondering whether any of you could speak to that issue. What do you think that there is a reluctance for people to call and seek support, and what might be the reasons for that underreporting or that reluctance to reach out about these issues?
Well, I can just speak from, when we've been there, we get called out, and I know it's underreported because, the officers will talk to the victims and they're like, it's just too much this time. Mm-hmm. Now they're hitting the kids. Now, look at my face. And I know they haven't called multiple times, but I also think it comes to immigration status. Mm-hmm. I think it comes to, gender preference. They're afraid of law enforcement and what the response may be. I think our homeless population is extremely vulnerable. I'm sure that we don't hear everything that goes on within those, encampments. And I think some of the women, especially, they're extremely vulnerable. I've walked those encampments. I've talked to some of the ladies, and through the mayor's office, was able to get some real help, and through our partners, which is fantastic. But I truly believe that we're probably seeing, about this much.
Yeah.
I would just add, across the board, data collection around sexual orientation and gender identity pretty much doesn't exist.
Wow.
And so this is something we have really struggled with in terms of how do you dedicate resources when you're not, able to identify who's coming in for services.
Yeah.
And then I think there's other pieces, which is, why would someone be afraid? I can think of they're afraid of not being believed. They're afraid of being mistreated, as you said. I was recounting a story told to me by one of our medical providers where a lesbian went in and to our emergency room after being really violently attacked, and the doctor didn't believe this could have happened by another woman. And she suffered traumatic brain injury. Mm-hmm. I think, and then once you have that experience of being disbelieved, which the batterer is telling you, no one's going to take this seriously. No one's going to listen to you. No one's going to believe this, that you're afraid of me. And we hear that's been the response. I think it makes it really challenging.
Yeah. Wow.
You just brought something to mind. I remember this story. We had a case, and it was over here in the Valley, extremely beaten. Horrible. I'm just going to say horrible. When I say that, I've seen a lot. They didn't call. Family called. And the shame, I remember, and the reluctancy to report. The detectives did a fantastic job. We worked, I want to even say, I believe, with Family Justice Center on this case. But you're right, the reluctance, the shame, and didn't think because of what they were engaging with, what they were engaging is, was worthy to be a victim of a crime. And it was amazing to hear someone, raped and beaten in a situation like that. And so it just kind of brought that to light, and you're right, we've seen it.
Yeah. I would absolutely agree. There's a deep stigma, and there is just a feeling of shame, and that is deeply rooted in a person's ability to come forward and seek help. And I think, again, if we're really trying to expand the definition and support more individuals that are experiencing this type of trauma, we have to look beyond the physical and look at, again, the psychological and the emotional and the economic abuse. Oftentimes, again, there's control over them. And so it could be that they're not allowed to work. And so where do they go, especially if they have children? So I think there's real challenges. And I think as leaders in this space, as committed individuals that are really trying to help as many people connect to services, is really amplifying that services are available, and then continue to advocate for the increased availability of these services as well.
But it starts here with you bringing the awareness.
Absolutely.
Well, all of you. I mean, I'm really new to this, but
And-
so go ahead.
I was sorry, I was going to add. You know, it goes back to our first conversation about the definition, right? And again, a lot of people won't make a report because it wasn't physical. We do see a lot of sexual coercion within relationships and domestic violence where the victim may not see it as rape or sexual abuse because they're like, well, this is my partner, therefore I'm obligated to. So a lot of times that goes underreported as well. And there's a financial aspect to it as well. If maybe the person's not working, if they say, well, if I leave, I don't have anywhere else to go. They may not have the support of family members because the family members or friends may be done with the relationship, right? People tend to get frustrated with people who are in domestic violence relationships, and they may not feel like they have the support that they need in order to leave, or the financial stability to be able to leave a relationship.
Well, so let's talk about those resources. Let's talk specifically about those resources, because I think we want to make sure that the information that you all are sharing today doesn't just get out through people watching this one discussion, but that we can list them out, that we can make them available publicly, that we can put it into public outreach that we're doing in the community and that other council districts are doing in their communities. So do you want to, I would love it if you could share more about what resources are available to people and how they can access them. And Abigail, I don't know if you wanted to start.
Yeah, so the first thing I'll say is that we have increased the budget from, the $2 million that we were initially investing to currently $14 million that is been allocated in the city's budget specifically for
That's a big increase.
survivors.
Yeah,
Yes, so
that's good.
Thank
Proud
you
of that.
for your
Well,
support. And
a lot of that I think happened before I got there, but still, that's a bit substantial increase.
So what we're trying to do is really just, again, expand beyond shelter-based services. We know that that is one option, but that should not be the only option. We are going to be launching in the next couple of weeks a Housing First program for survivors, and that'll be connected back to our shelter agencies. And I think you described there's a state program that was funded, and it funded a few of the agencies in the region. And we're expanding that support to all of our 12 agencies that we currently fund within the city of Los Angeles, that they'll have those flexible funds to be able to, so hopefully we're not turning people away. If we don't have space for people in our shelter, we can provide them with a voucher at a hotel for temporary couple of days, or help them with a security deposit in their own home, or help them along the way. There's a panel, since we're approaching October, which is Domestic Violence Awareness Month. We're preparing for a panel, and there was a woman there who was a survivor and talked about this actual program through one of our agencies, Rainbow Services, where she was able to seek services. There was no space for her, unfortunately, in the shelter, but because of these flexible dollars, they were able to temporarily house her in a hotel initially, and then move her into a one-bedroom unit. And then they didn't walk away from her after that. She was able to connect back. She purchased a car. She started working. Her car broke down. And she came back to us and said, can you help me fix my car? Because if I don't have a car, I can't get to work. And if I can't get to work, I'm going to lose my unit. And so we were able to provide ongoing support. And I think that's where the field has been evolving. And I'll just say, even for myself, I'm not an expert in domestic violence, but I do think that we have a shared responsibility to lead with compassion and with empathy, and to listen. And that's exactly what I did in my role, is just listen to the experts, and to continue to advocate it from where I sit, to be able to increase the resources for this population.
That's great. And if people want help who are in the city of Los Angeles, how do they access that support? Who do they call? How can they get into this shelter system, or how can they get access to these flexible subsidies?
There's a hotline. It really depends if they have, if it's a LAPD related incident that we're LAPD response. We do have a crisis to shelter program as well, in partnership with LAPD, that provides temporary shelter to individuals that have been referred to us by LAPD. We have our hotline where people can seek shelter services. That's traditionally how we are able to respond and support. I'm sure there's other ways as well.
And are the referrals from LAPD the primary number of users for the services that the city is providing?
For our crisis to shelter program, yes,
Okay.
since it is a program in partnership with LAPD, and that's specifically for individuals who are either, they're not under custody, but they're with LAPD being served. There was an LAPD officer who reported to that incident, and so they're being temporarily housed with us. There's the hotline number, which again, I feel we don't have capacity for. Again, we have so many calls that are coming into the hotline number. And again, it's hard to tell. Some of them are duplicative. Some of them are not asking for shelter services. They may need a connection to a legal service provider. They may need other types of services. And then there's just the referral through our agencies. Most of our domestic violence shelter agencies also have drop-in centers that are outward-facing community centers, and they're providing a lot of services to the greater public. And so people learn about our services there as well.
Okay, great. Do you want to talk a little bit about how people can access the services that you're providing,
Yes.
or services broadly speaking in the community that
Yes,
you'd like
of
to draw
course.
attention to?
So we service the San Fernando Valley and Santa Clarita area, and we do provide individual counseling. We do have domestic violence groups and parenting groups, as well as family counseling. We do have the domestic abuse response team that I would like to highlight because it's in partnership with LAPD. And we do have, Strength United has advocates at 5 of the divisions in the Valley. So it's 5 out of 7. And our advocates do roll out with law enforcement, and they provide on-scene crisis intervention. So they're right at the scene, after an incident has occurred. And we do work with, our crisis to shelter program, where we're able to connect someone and put them in shelter that night. But we also continue doing follow-ups. We continue with the case management, making sure that we're linking them to services, whatever they may be. And we do have a hotline. It's 818-886-0453. You don't have to have a police report, to access these services. Again, we do not ask about documentation status. Someone can just call in and say that they'd be interested in services, and we would be able to take down the information and have someone call them.
And for both of the hotlines, these are 24-hour hotlines?
Yes,
Yes.
24-hour bilingual as well.
Okay.
If
That's
I
good
could
to know.
follow up,
Yeah.
because the Family Justice Center is in your area. It's in the Van Nuys, and it services that area, and it's a fantastic resource for us. We go there, and we have the experts in there. We take our victims there, and it's often just one interview because we have that experts, we have that support. We have actual detectives that specialized in domestic violence there that handle the cases, and what we can kind of do is get that information to get, obviously to the prosecuting side, but we can then hand off almost with the DART program is what we call it, and the team members and Family Justice Center, which is through Strength United, to get all the wraparound services that goes to, your section. And we're not just saying, okay, we interviewed you, here you go. It's having these programs and the collaboration that's really, I think, helping our victims. And I know it's cliche, but hopefully breaking that cycle each time that we can.
Yeah. I would say one of the things, because we know many members of our community don't want to call 911.
Yeah.
And so we encourage people. We tend to use the 24-hour national domestic violence hotline, which we know had pretty extensive both LGBTQ training, and also they have tech. You can chat, you can email. There's different ways of access. Not that there's anything wrong with local, but that tends to be one we rely on. And we have 2 programs specifically for survivors, one within our legal services department and one within our mental health department. And so people, you can get that information on our website and come in. In addition to survivors, we also offer a batterers intervention program, one of the few in the country focused on LGBTQ people causing harm, and which is, probably for another conversation, but I think is a really important component, particularly if you can intervene early.
Yeah.
Because for most of the people we work with, they, some do, but for many, it's not that they want their person that they love to go to jail.
Yeah.
They want the violence, they want the harm, they want the abuse to stop.
Yeah. So can you talk a little bit more about that program? Because I think you're right. There is often a lot of fear to call 911. There's a lot of fear to interact with law enforcement for a variety of reasons, including, I think, potentially a fear of retaliation from your partner. There's so many reasons. So tell us more about what that program looks like and how it operates. Because that to me, that sounds really where we want to be intervening on this issue, really.
Well, one of the things I think is really unique about the program we operate is that many people are self-referred, which again means that they're not coming through a criminal justice mandated, you must attend a 52-week batteries intervention program. Some people are, but we actually screen everyone coming in for couples counseling for signs of intimate partner violence. And then we talk to people, and because a lot of times I think there's a kind of notion in the DV community, we really generally discourage couples counseling because of the dynamics that can occur. And so so we're able to identify things often a little bit earlier in that situation. And so people are choosing and they're engaging in that work and they're working through the shame. And I think working also through internalized, whether it's internalized heterocentrism, bias, because often that's reflected through their partner. So you really, it's a long program. It's a commitment, but I think it makes a difference. And I do think we need to be exploring more of these types of alternatives. I don't know whether the two of you wanted to talk about any other kinds of interventions that can be helpful. So a lot of the resources that you talked about, all four of you, are resources that come in after violence has occurred. And I wondered whether you can talk a little bit more about prevention and what that looks like, what programming looks like that really has prevention at its core, and what kind of support that would take from the city to keep that to get that stood up.
Do you want to talk about the domestic violence workshops that you've helped us with? Because I think it educates people maybe like this is going down that path and it might go along with prevention.
Yes. So, we go to parent centers and we will put on workshops on healthy relationships. We don't try to call it domestic violence, right? Because we're not going to have people show up.
No one will come.
So we do tend to focus it more on what a healthy relationship looks like. And that, I think, to them, piques their interest, right? Because someone may be sitting and hearing this, this presentation and be like, well, wait a minute, my relationship does not look like that, right? Or it's getting to a point where it's no longer becoming healthy. So we do, and we have many times advocates that are there or counselors that are just hanging out, in the background in case somebody, after the presentation wants to speak to someone, they're able to, and we'll, link them to services right then and there. We also, through our prevention team, have a program where we have, people from our prevention team go out to schools and talk to teens about healthy relationships.
Wow.
So that's something that we do as well. So, like you said, try to get them early so that they also know what a healthy relationship is supposed to look like, because many teens may not be growing up in a healthy relationship. So if they're witnessing or being exposed to domestic violence, they may think that that's what a relationship is supposed to look like and grow up to be in the same relationship as their parents.
Yeah, and that's absolutely true. On the prevention side, we leverage the infrastructure of our family source system, which is a place-based anti-poverty program in the city. We have 16 centers across the city that are focused on supporting low-income households primarily. These are households that are unfortunately making anywhere from $15,000 to $20,000 a year. They have multiple challenges, and the unfortunate reality about domestic violence is that it is generational, as we're talking about, unfortunately. So you want to break that cycle. And again, not to sound cliche, but our mission in the Community Investment Department is to break the cycle of generational poverty and to really focus on trying to bring as many resources into households, into communities, so that we are empowering our residents to make choices for themselves that help them live prosperous and healthy lives in every way, in every possible way. And so our Family Source Centers, we have a relationship and a partnership with LAUSD where we have people service and attendance counselors that are co-located at all 16 of our Family Source Centers. We're offering a number of workshops throughout the year, both to parents and to young people as well, really focused on the healthy relationships. We don't call them domestic violence. We also have, all of our Family Source Centers have marriage and family therapists and counselors on site, so we are really focused on the prevention front as well.
And what is the extent of usage of the Family Source Centers? Like how many families do you serve annually, and are those repeat visits, or is it one-off? You come in, you access a resource, and you leave, and you don't really have an interaction with the city again?
It's a great question. Family Source Centers serve 40,000 unduplicated individuals annually. During the pandemic, we actually served closer to 150,000
Wow.
unduplicated individuals, and they provide a variety of different services. They help, they offer case management services. They help with utility and rental assistance. They offer free tax preparation services. Again, really trying to help families and individuals connect to all of the available resources to help themselves and their families. And so, yes, we do serve a very large number of individuals. These are unduplicated. We offer food assistance. I mean, you name it. There's a variety of different services that are provided through the Family Source system, but 40,000 unduplicated.
Great. I don't know whether you want to speak again to this idea of prevention, or
Well,
whether.
one thing I think we also aren't talking about necessarily is how do we change society's response? And so I think about how many people's first response is just leave. Or, you know, why do you stay with this person? And what we need people to really understand is that leaving is dangerous. It's in fact the most dangerous time. And so I think one of the things I'd really encourage people, if you are experiencing intimate partner violence, reach out for assistance. Have a safety plan. Figure out the resources, because it can be, it's just too easy to say just leave.
Yeah.
And what it tends to do is, batterers again use that, and they try to isolate survivors from their entire network, and that, like, well, why haven't you left this person? I'm not going to be here as a resource. You know, they intentionally cut off those points of contact. And so I think when we think about prevention, what also are we doing, right, as a society to really be there and support people in challenging times?
Yeah, that's such widespread education, and I think honestly, to me, that's something that we need to be looking to one of our biggest industries locally to be talking about. I feel like the entertainment industry needs education and how they think about abuse and violence in relationships overall, and to reframe how you respond to that violence in television and in movies, because I do feel like the response that you see in a lot of cultural, public culture is really just leave.
Yeah.
Or that leaving is valorized, without really considering the dangers of leaving, and without really considering what it takes to be able to leave a dangerous relationship. So
Right.
I appreciate you bringing that up. We had a couple of questions that came in, so I want to just ask those as well. One of the questions that came in was about abuse of children. And how that relates to domestic violence overall, or intimate partner violence. Have you seen in your work an increase in that kind of violence during the pandemic? Are these two connected? What are those connections? Love to have you speak on that if you could.
When we go, a lot of times, and like we said, it's later and everything's falling apart. We go into homes with, multiple children, and we deal with the domestic violence, but the trauma of our really most vulnerable victims, is right there in front of us. Thankfully, we have centers that now are have been very accommodating, so we can take the family with them. But we see, and I think it was already referred to, is that acceptable, because that's what they've grown up with when they become into relationships, and that's what's scary. Because I was talking to, I went out to a scene in a backup, and I was talking to It was a domestic, and I was talking to one of the 13-year-old children. She goes, you know, this is what they always do. She goes, it's okay. And she had a brother and a sister sitting with her, and she goes, I got it. I know how to handle it. I'll take care of them. And I thought, you're 13 years old. We're out here at midnight on a bus bench. Your dad crashed the car trying to kill your mom. You guys are in the back seat, and you're telling me I got it and it's normal. And there's those vulnerable victims, and what can we do? You know, okay, so we arrested dad. You know, we got mom on the way, but next time, and what about them? And that's troubling.
And so what happens to children who are in families where there is domestic violence? What are the resources available from the city, for example, for children in those cases?
So we have shelters that serve families, single parents that are fleeing that have children, and we house the entire family. We offer counseling services, both as a family and individually to the children as well. I would say that there's a lot of PTSD that the child has to overcome because of that trauma. So we do offer counseling services once they're in shelter, and we also connect them to legal services as well, or any other types of medical services that they need.
And is there a long-term plan for kind of staying in touch with children in families that have been impacted by domestic violence? It is, because it feels like there is a need for ongoing support for children in those households, for sure.
Mm-hmm. Yes, and I would like to add, at our center, we do provide services for minors, the children that have been exposed to violence, and we always encourage, the victim to sign up their children for services, because a lot of the feedback that we get from people are, well, they didn't witness anything. Mm-hmm. They weren't there when it happened, but that was just that one time, right? We don't know about the rest of the days. We don't know what else they've been exposed to. So we always encourage them to seek services, and we do have ongoing case management. So let's say a family has completed their therapeutic services with us, they can still continue with case management services. So if they still need help with linking to housing or any other type of work resources, we do have case managers available that will help them. And I think during the pandemic, things got a little scary, especially with children, right? Because for the most part, from what we know, is when children disclose abuse, it's usually to a teacher, right? Outside of the home. And during the pandemic, children weren't going to school. They didn't have anyone to tell that they were being abused, because most likely they were living with the abuser. Right. So as of right now, we could be seeing an influx in reports right now because of that, because they're back at school, they're back at a safe location. Mm-hmm. So we will most likely see that people are now going to be reporting abuse.
I want to ask a question related to both teachers and to police officers. Mm-hmm. It feels like both teachers and police officers encounter individuals who are experiencing domestic violence. Are they provided adequate training to be able to respond to these situations? And if not, what is the kind of training that we need in this system to be able to empower teachers, police officers to be able to respond to these situations with the sensitivity and the knowledge of the resources available that I think these situations require? I think anybody can speak to this, but
yeah. We have a suspicious child abuse report, suspected child abuse report, SCAR. I'm sorry. And our teachers are fantastic in our school systems. They see something wrong. They're mandated reporters. We're all mandated reporters, and we take this report. In Los Angeles Police Department, we have 10 days to review that. What I can say out in the Valley is we do have the Department of Children and Family Services workers with us that respond out with our officers that are assigned specific to that to go get the information. But like you said, locked away, we were having, where we would, the last division I worked at would have, 1,000 a year, we're down to, double digits. So we knew something, was going on because they're not out, they can't report. But now that school is back in session, we are seeing that increase. We take these matters very serious. It's near and dear to me. All my commands, we check it regularly to make sure that within 10 days we're getting a response. But that's, what we know, what we see, or friends report. It's what we don't know that is scary, and where I think if we empower our victims that are our parents to be able to have a voice, we'll be able to know more and get in there sooner, like you were saying, somewhere to call.
So one thing I want to say about mandating reporting, and when I think about the city, so I'm not a mandated reporter, I'm an attorney and I have a legal background, and sometimes I think people are actually afraid to go to certain professions because they know and seek assistance because they know that they're mandated reporters, and that can actually be a barrier because I think we have to figure out what does the mandating reporting trigger, and how is it supportive, and not start to create a cycle of negative responses. And so I think there's lots of reasons why we have mandated reporting, and there's good sides of it, but how do we also ensure that, right? Like, so I think about teachers. I know not all teachers are trained on LGBTQ cultural competency.
Right.
Right. I know, and then you get potentially into a situation where, DCFS is involved, and then how does that bias then play? And this isn't just specific to LGBTQ communities. You think about undocumented people, and then how much of that then falls back on the survivor.
Yeah.
In a way, like, and I think most of us who've worked in the field have seen, unless you do X, Y, and Z, we will take away your kid, to the person who's being abused. And a lot of the burden and responsibility can then fall on that person who may be dealing with issues of language access, discrimination, poverty, right? And so when I think about what are these interventions look like, that's where I also think, how can the city, how are we supporting people? How can we both increase safety and support people without being punitive?
Yeah.
Yeah, that's why I think prevention is key. And for us, I absolutely agree with everything that you said. We have been very intentional, especially with our relationship and partnership with LAUSD, that this is a piece of the training that we offer every year to our caseworkers across our system, so that it's a commitment that we're making to making sure that we are very intentional about training, because there's a lot of turnover as well, especially with nonprofit organizations that are not experts in domestic violence. But again, that prevention is key. So we've been very clear that this is a commitment that we want to see happen year after year, that we are trying to catch. And yes, absolutely, early months of the pandemic, we weren't able to have those interactions with children who oftentimes do come forward or they show signs. And so, but we saw it in other ways, right? Through the Project Safe Haven program, as I mentioned, which I would say had, I think it was 80% of the survivors that we housed had children who were actively fleeing with children. Yep.
Wow.
Work to be done.
Yeah. And I had one last question, which was actually about kind of police being the first line of response to many issues related to domestic violence and issues related to trust of LAPD, which I think, especially over this last year and a half, has been a real issue.
Yes.
I think there has been studies that have also shown that people who are involved in law enforcement are sometimes more likely to be abusers themselves, and so there are some real challenges around trust and law enforcement. And I'm curious to know how you've addressed these issues, and how everyone else on this panel might offer either ways to address that issue or ways to offer alternatives to calling law enforcement that are needed in the city for people who may not be able to have that trust.
Those are difficult times.
Yeah.
We're not seeing people at their best when we arrive at the door. We train our officers to be compassionate, to do a thorough investigation, because I think you need to get all those issues. I mean, those are that preliminary investigation really gives us information and insight when a victim, for cooperation. So we train our officers regularly. We go out. with, like I said, a service provider, the DART, and I think that that's fantastic. They
Yeah.
respond to these domestic calls. They offer the services. They bring that perspective, maybe that softer perspective than the uniform.
Yeah, and I think that's a good, really
Right.
important thing for people to know, that if you call related to domestic violence, an officer is likely not going to come alone.
Yes,
That
they'll be with the provider.
That they will be with the provider, and I think that's useful information to share with the public and for people to know. So, I think that's I didn't know that before.
Yeah, and it's a fantastic program, and the mayor has been, putting that at the forefront in continuing the funding, even in, the most difficult times. But it's, I think, our partnership and the collaboration we do. Again, I go back to Family Justice Center because I think it's unique in the Valley, but having experts, having the services and the tools, and not just us being there.
Yeah.
We have a whole lot of people to educate us, to help us and help work with our victim, so that, like I said, we just don't, leave them at the door with nothing. But again, it is tough times in policing, but we're professional. We take these matters serious. We discuss them all the time. I'm continually looking at numbers, which is, I think, the first time we met, why I was rattling it off, because it does matter, and it is really important. My biggest thing I think I could say before, because I know we're getting towards the end, is we're here, and we don't want to know your documents, your immigration status. We just please call, and call early, not when what I've seen. We're here. We will find help. We have service providers. We have people out here to help.
Yes, and we've been able to create a great partnership with LAPD and our Strength United advocates. They'll go out to the roll calls, and it's not just about our domestic violence victims and the children. Every shift that they're on, they'll go to the roll calls and they'll say, hey, Strength United advocates here, if you get a walk-in, if you come across somebody that may need our services, please let us know. They also provide them with the psychoeducation that they may need, and also talk to them about the services that are available, because, officers aren't really thinking about that. Officers aren't case managers or a part of social services. So we do bring that, component to the divisions that we work at. And, we've been able to help out in that sense and bridge that gap.
And
just
they're great.
Real quickly,
Yeah.
I think one of the reasons that community partners are so important is we do not require that someone file a police report,
Yes.
or and so we can work around. And if you want to file a police report, we can also have an advocate go with you.
Right.
And so I think that's really
So that's
important.
another way to address this issue.
And
Yeah.
if people are experiencing bias or problems, that we're also around to assist with that.
And we will welcome the advocate in with the victim, the whole process, because it makes it easier for us to have somebody to lean on, and that emotional support and that relationship you already built to make that better interview and help us with our case. It's important.
I actually have a story about that. It actually happened at Mission, where we had someone walk in and go to their front desk and was just asking questions and related to domestic violence. You can tell that they didn't want to make a report. They were really scared. The front desk officer knew that the advocate was upstairs, called her over. They met in a private area, and she was able to tell her, if I report, are my kids going to get taken away? Am I going to get deported? So the advocate was able to explain everything to her. And at the end of everything, they were able to bring the DART officer, and again, in a private area, able to take a report for her. And it was done in such a great way where, the advocate was able to ease that anxiety and answer all of the questions before she decided to make that report.
Well, this is great. I want to just take a moment. I feel like I learned a lot today about the system that we have in place to address this issue. I'm happy that it's grown, but it sounds like there is still a need for more training, more alternatives, for people to call, more people to lean on, and certainly more prevention going forward. And I think, I'd love to talk to each and every one of you again to understand how the city can support real, substantive, robust efforts at prevention, and to make it as easy as possible for people to end violence in their own situations and in their own homes. So Thank you all. I'm so grateful for you and for the what you've shared with us tonight, and appreciate your presence here. Thank you.
Thank you.
Once again, if you need additional information about domestic violence and the resources that are available to you, you can reach out at the telephone number and the website that is on your screen right now. And we look forward to continuing to share more information and resources with the public and compiling everything that we've heard today into something that can be widely shared and into building a better, safer city with all of you. Thank you very much.